Hi, and welcome again to the third in our four-part series offered by the National Consumer Voice and the National Long-Term Care Ombudsman Resource Center. My name is Dr. Sherry Gibson, licensed psychologist, and I'm very happy and privileged to be bringing you another webinar, this one focused on compassion fatigue during a time of COVID, taking care of ourselves in order to take care of others. This particular webinar is dedicated to the direct care staff of long-term care communities. As you all know, our work is technically demanding, requires a lot of accuracy in your documentation, in scheduling, not only your own hours, but also the routines that have to happen within long-term care. There are complex logistics that are involved in your work, but it also demands a lot of our humanity. Your hearts and minds and spirits are unavoidably challenged by the fact that you've been facing death, human grief, suffering, anxiety, isolation, all creating a perfect recipe for fatigue and burnout. And if we're not as aware, skilled, or trained about attending to ourselves as we are to our technical duties and to our residents, we risk not only technical and service failures, but the erosion, even breakdown of our personal well-being and indeed the rest of our lives. The erosion of our work efficiency and our whole lives has come to be called compassion stress or compassion fatigue. Often leaves us thinking at the end of a day, is there light at the end of this tunnel? For many of you, you are fighting the good fight day in and day out in the work that you're doing with residents around this country and going home to your own families and situations. For many of you, you probably saw the last webinar, which involved a video, included a video by Brene Brown, looking at the differences between empathy and sympathy. So what is compassion? How is compassion different from those things? On here you see Gandhi and Mother Teresa, the great healers that we all knew or have known. And we know that compassion is different. Compassion is an emotional response that when we perceive suffering, it also involves us having a desired, authentic desire to help. The word compassion is rooted in Latin and Greek language, patai and pathian meaning to suffer, and in Latin, com meaning with, suffering with. It is essentially the feeling of sorrow or concern for another, coupled with that desire to alleviate the suffering. So essentially it is the I feel for you, which is sympathy, plus I understand you, empathy, plus I want to help. And combined, that is compassion. So all of you out there listening to this, you are all doing compassionate work. There is a cost of caring. Our work, your work, is centered on the relief of suffering that involves absorbing information about suffering and thus absorbing that suffering itself. This is referred to as secondary victimization or vicarious trauma. Trauma by concern is the other term. And that means that when we see day in, day out suffering, we become traumatized by that suffering and we start to integrate it ourselves. There's another type of suffering or a phenomenon term that's called kismal trauma. And that's when an entire system, meaning a community, is affected by the trauma to even one of its members. This couldn't be more true in long-term care communities, where you have death that is probably likely occurring at unsurmountable numbers, and where many of you are having to respond to that and see it and witness it, maybe even hold the hands of multiple people dying in a week, and losing those important members of your community affects the whole community. Compassion fatigue as a term, as a concept, was first developed in the early 1990s by Joynson, and then was later developed by Figley, who created a model to help understand how do people develop compassion fatigue? What are the risk factors? And that model has been used to describe how those symptoms develop over time and has been translated to multiple care settings, including healthcare settings, and people who are serving in different roles, both formal and informal caregivers. So I want to just briefly walk you through this model so that it helps you kind of put meat onto the skeleton, if you will, and think about where, for you or others that you're working with, might be developing compassion fatigue. So there's two important components. First, at the very top on the left-hand side, you see a block that says exposure to suffering. On the very bottom is concern. And then the part of us, most of us that work in healthcare, have an ability to be empathic. Those three things combined lead to an empathic response. Now, two other important things that happen here is our ability to detach from suffering, or to detach from our work, and the sense of satisfaction that we get from our work. When we are overly attached, we start to lose our satisfaction. And all of those things then can lead to what we call residual compassion stress. Two other important things happen here. That is prolonged exposure to suffering over time, day in and day out, and the traumatic memories of prior sufferings that we've witnessed. The last factor here, risk factor, is a really important one, and that is other life demands, because you and I both know that we don't just work. We also have other things that we're doing. You all might be going home to families. You might be a single parent. You might be caring for a person with disability, or people, multi-generational families living together. You might have a spouse who's lost their job or lost health insurance. You might have financial stressors that you had prior to COVID and now are even more exacerbated by COVID. All of these things, in addition to our work, can lead to the development of compassion fatigue. There are some other factors that are important to note here, and that is our work environment, the environment itself. So part of that is the culture of our work. What kind of support do you get in your community? What are the policies and the regulations that during this time are ever changing? What kind of social acceptance do you have in your workplace? Is there a level of activism present in your community? And the work setting is also important here. The physical environment of your work setting, your employer's values, the culture, the tasks that you have to do, the guidelines that you have to follow, and the management and your colleagues. All of these things can contribute to our stress and can contribute to our coping and the development of compassion fatigue. There are some other external factors that are important to note, and we refer to these as the 6 futilities. That is the perception of the suffering that we see, our attitudes about that, the demands of residents and families, the institutional demands, communication and treatment errors that inevitably will happen in any healthcare setting, feelings of inadequacy, or a sense that the care isn't benefiting the resident. Our internal factors also play an important role here, because most of you have that personal gift of empathy, but with that comes a bit of a curse. High empathy helps us understand people, but it can also challenge our equanimity. Our personal histories and our personality play a big part in this too. How we cope with stress, how we respond to change, how do we adapt? Are we easily adaptable, or do we have more problems with that? Our family and our social histories, our personal boundaries, unresolved personal trauma can be a factor. And an overgeneralization, that is thinking that others' experiences are similar to ours without recognizing that we may be in the same situation, but I'm going to experience it very differently than you for numerous reasons. So when we do that overgeneralization, it can set us up. Another factor is what we call pathological altruism. And this is a combination of having an excess of empathy to the extent that we cannot self-regulate. When we are so anxious about something, we overextend our empathy. So we're more focused on relieving our own discomfort rather than another's. And by doing this, you can imagine we kind of work ourselves into long hours, overextending ourselves in ways that are beyond our job responsibilities. When we do that, we set ourselves up for that erosion. So two things can happen here: burnout and compassion fatigue. And believe it or not, just like empathy, sympathy, and compassion, these two terms are also very different from one another. Burnout is a gradual physical, mental, emotional erosion that's due to that long-term involvement in a emotionally demanding or unfulfilling situation. It can result in being physically or mentally exhausted, feeling hardened or numb about work, and also feeling like there's reduced accomplishment, achievement void, low satisfaction. Burnout is the kind of thing that can happen in any profession. It can happen to an engineer, a banker. It's the kind of thing that does in a human services department. Compassion fatigue, on the other hand, feels similarly to burnout, but it emerges very suddenly. It has an existential and spiritual effect, meaning that people report they feel this overarching feeling of meaninglessness, worthlessness, hopelessness. They isolate themselves from their supporters, and there's a hypervigilance or fear about the future. Symptoms are often disconnected from the real cause. For us as individuals, some of the symptoms that come up in compassion fatigue is difficulty with concentrating or attending, exhaustion, nightmares, flashbacks, overreaction or avoidance to certain sensory or emotional stimuli, chronic physical ailments such as colds or GI problems, stomach problems, apathy, or a clinical term we use called anhedonia. Essentially, that's the loss of pleasure in pleasant activities. An excess of negativity, blaming others, complaining, compulsive or avoidant behaviors such as overeating, gambling, substance use, problems in our personal relationships, unable to maintain relationships, problems with intimacy, denial that we're having any difficulties or problems. And what's true about this is that when we are experiencing compassion fatigue, we often do not notice the symptoms in ourselves, but we notice it in other people, or other people will notice it in us. And right here, it's important to note that when you see these symptoms coming up in a friend, a colleague, maybe it's a family member of a resident, what we typically do is we don't approach those people in a compassionate way. We are often judgmental, we're frustrated, we're irritable with them. And so this is an opportunity for you to remember that people don't see this in themselves. They're just struggling to get by. So if we can approach people with more compassion, to inquire how they're doing and if there's something we can do to help, we'll often find that a person may open up to us, and maybe there's a way to intervene or to prevent things from getting worse. Because the last thing any of us want to do is to, especially in this work environment right now, is to lose a colleague. You're already stretched. You're already experiencing high turnover or loss of staff members. And so right now, to be more compassionate towards one another is probably the most effective and sustaining approach. Compassion fatigue also, as you can imagine, if it affects us individually, it's going to affect the system of care. And in the institution, we'll see high absenteeism, high rates of staff turnover, increased difficulty with people completing their tasks or assignments, not respecting or meeting deadlines, unprofessional outbursts of anger or even aggression, instability in relationships, a desire among staff members to maybe break the company rules, take extra time off without clocking out, or actually take things from an organization. People feeling very inflexible or an increased rigidity, a resistance to change, not adapting or being adaptable, excessive complaining and negativity towards management, maybe even skepticism or apathy about the organization's vision or their future, and an inability to believe that improvement or hope is even possible. This is how it affects systems of care. And it would even, it wouldn't surprise any of us then if it affects our system. It also affects our residents, and it affects the families. It reverberates when we don't take care of this very important part of ourselves. Why are we so susceptible? Well, there's two biological processes that happen in us: the sympathetic nervous system and the parasympathetic nervous system. The sympathetic is involved with that fight, flight, or freeze response that I talked about at length in the trauma-informed care webinar. And that's our body's biological adaptive response to a real crisis. That kind of thing wilts us day in and day out. And it couldn't be more important or more relevant than right now during COVID. The parasympathetic nervous system restores our equanimity, physiological equanimity. It gets us back into homeostasis. It's what keeps us rooted and helps us to tend and to thrive. So some of the skills I'll be teaching you today is really targeted towards that parasympathetic nervous system. Again, in this time during COVID-19, we are all operating, and particularly you are operating during a time of heightened anxiety, uncertainty, unknown about the future, ambiguity, having to make decisions all the time around risk. And it's chronic. This state that we're in right now has been chronic. We've been in it for 6 months, and it seems like some days there's no end in sight. That perception, that attitude, all of these things, again, can make us vulnerable to compassion fatigue. So how do we protect ourselves? The antidote to any of these things I've talked about, trauma, burnout, compassion fatigue, is resilience. The good news is that, yes, resilience we can be born with some degree of that, but it's also something that we can learn. It's something we can be trained to do. And that's the good news. Resilience I like to think of that as like a rubber band. It's the ability for something to return back to its original shape after it's been pulled, stressed, stretched, pressed, bent. It's also, psychologically speaking, the ability to recover from or adjust easily to a misfortune or a change. So we all need to develop skills to stay well, not only for our better performance in our jobs, but also just our better well-being, particularly in this high compassion stress work that you're doing. No pressure, right? Now, you all are heroes. What you do is heroic work. And you all know that there's one thing: every hero has a personal vulnerability that brings them to their knees. And when they fall hard. So what we want to do here is we want to focus on what kind of skills can you build so that you don't fall hard. How do we figure out what your kryptonite is? How do we prevent and protect ourselves from the hard fall? It has to start with self-awareness. And the first self-awareness skill to resiliency is being aware of our physical and our emotional states. This is really important because we are always so aware of the technical side of our work that sometimes we negate or we ignore the physical and emotional piece of us. And it's very easy to do. It's really about taking a moment to know what's happening in your body, your mind, and your spirit in this moment. Noticing, do I have a headache? Am I feeling tired? Are my shoulders tense? Am I actually feeling on the brink of tears? When you know what's going on inside of you, you're also very aware of what's happening in others. And sometimes what's happening in us mirrors what's happening in others. So again, just bringing your awareness to that physical and emotional state can be very helpful. Also attending to your technical abilities, asking yourself, are there skills or knowledge bases that are natural talents for you, and where do you need to put some extra effort into developing more? We can't all be good at everything. There are certainly things in the technical side of your work that you could get more education on, or maybe ask for more assistance. So know what your growing edges are, as well as your strengths and your blind spots, and build those up. Get better and more efficient at those things in your technical work. Because I'll tell you, it's those technical things, those little details that can really trip us up and can add to our stress in insurmountable ways. We don't really notice it, we don't recognize it, but it has a cumulative effect on our well-being. The last part of awareness is that the work that you're doing, particularly right now, really puts a toll on our existential, spiritual well-being. The nature of your work begs all those big questions around a good death and a bad death, for example, good and bad, justices and injustices. It's important for all of us to spend time consciously exploring those big questions about life and death and truth and justice and good and evil. When we take the time to explore those areas of ourselves, we start to develop a language and a coping strategies to help manage the insurmountable amount of suffering and tragedy in order to find meaning. The second part of the skill building is self-regulation. Now, as you all know, self-regulation means kind of finding our brakes, knowing when you're getting triggered and when you're starting to ramp up. It's unfortunate that most of us have never been taught how to regulate because we crave excitement. Pulling back is boring. We want the excitement. And some of you are in this work for the excitement. It's also important that we know what our boundaries are. We get clear on what our values are in our work, and we try to manage that arousal. So knowing, again, when you have self-awareness of your arousal state, noticing when you're perspiring, notice when your neck gets hot because you're getting angry or anxious. Notice when your breathing is starting to quicken, or let's say you're having some thoughts about yelling at somebody or getting angry. Having some regulation, pulling back, taking a 10-minute break. These things are so important for your well-being and to the care of your residents. I can't say enough about self-care, although it seems hard to do during this time. Yes, we must all eat well, exercise, and sleep, but you have to find what's right for you. Don't be militant around this. If you haven't exercised in 2 months and now you're going to start a home gym, or you're going to log on to an expensive website cardiovascular program, you might want to also dial that back. Do what seems reasonable and do what you can be successful at. You also want to have fun like your life depends on it, because it really does. You want to find ways that you can get shallow, simple, and silly for your health. Pets and children are great mechanisms for this, but playing games, getting out in nature, it turns out that nature and connecting to nature has some of the most rigorous research outcomes when considering the effects on PTSD and trauma. Being outside in the fresh air, connecting to nature in whatever small way you can. If it means that you take your shoes off and put your feet in the grass, and that's all you can do, even on your break, that has a positive health benefit. And then also talking to somebody, but with the right person. And I'll talk a little bit about that in a few minutes. So you can do this now and pause the webinar, or you can come back to it. But I do want you to take a moment and get out a piece of paper. List one mini escape or a diversion that worked well to restore and to refresh you. List one thing that brings you joy, and then ask yourself, when was the last time you did it? What gets in the way of doing it more often? And what are some of your personal triggers that indicate it's time to recharge your battery? Another part of self-care is talking it out, talking about what bothers you. Talking, it turns out, is one of the most effective ways to preventing and healing from compassion fatigue. But who you talk to is incredibly important. That person has to be someone that can really relate to you and can be present without interfering with your process. Sometimes it helps to tell a person, look, I just need you to listen. I don't want you to interrupt me. I don't want you to fix anything. Just listen to what I have to say. That person also can't one-up you or switch to their story. You've probably been in this situation where you tell a person, hey, I had this really bad day. And the person goes, oh, let me tell you about my bad day. Yeah, you can't talk to that person. You also need to be with somebody who can understand and honor your confidentiality, because some of the things you need to talk about are deeply personal and involve your work, and they need to honor that. If you don't have that person, you should be utilizing your employee assistance program benefits. Through those programs, you have access typically to free counseling services that are confidential. I might also note here that if you're not in therapy and you're talking to a person and that person meets these qualifications, it's important to know that that person may not be your spouse or your partner. It may not even be your friend or another professional colleague. But find who that person is for you and who they could be, and be sure to talk about what's bothering you. Now, remember those external factors that I talked about earlier around your work setting and the culture of your work. For some people, compassion fatigue may be a function of the work setting or the profession itself. And it's important that we get some awareness around that as well. So you want to ask yourself, are you still committed to the community, to the agency's missions, values, culture, to the physical environment or the resources that are available to you? How does the organizational structure work for you? Are you committed to that too? The lines of authority, the style of communication? Are you committed to your colleagues, your managers and supervisors? All of those questions need to be asked. Because remember, I said before, in compassion fatigue, we're often disassociating from the symptoms. We're not connecting it to the real cause. And a lot of people in a heightened state of compassion fatigue will just walk out of a job. If you're starting to feel weary, ask yourself these big, important questions. And it's okay. You have permission to recognize when the job's not right for you, when your line of work isn't right for you, and you deserve to find the right fit. An old Chinese proverb says, dig where the ground is soft. Avoid solving the trickiest things in your life and pick some issue that you can most easily visualize changing or improving. In my own work with clients as a psychotherapist, I always ask the question, what's the smallest thing you can do to make the biggest difference? Ask yourself that, because it may be something very small, but it would make a big difference in your day or in this moment, maybe in this week. Take stock of what's on your plate. Make a list of all the demands that suck your time and energy. That may be at work, maybe also at home. What stands out to you in that list? What factors contribute to the overflowing of your plate? You might want to brainstorm this with a friend. I've had to do this multiple times in my life, and it's really been helpful. Start a self-care collection. Ask friends what they're doing. Start making out a list. You might learn something new. You could also start something at work. Couple of ideas I've listed here, starting a self-care contest each week, maybe creating a board where people list their favorite ideas. I was working in one place where somebody wrote on the board, best free events or free self-care. And it was amazing, the different types of ideas that people put up on the board. Maybe you want to initiate 5 minutes of self-care at each staff meeting. Find time for yourself every day to rebalance your workload. Delegate your work, but not only at work, but also at home. Are there things that you're doing that family members could pitch in on? Create a transition from your work to home. This is really important. It's really important for people who are working at home. For most of you, you're still going to work. And in that case, you want to make sure that you do something that tells your body, I'm now leaving work and I'm entering a different phase of my day. So making sure you change out of your scrubs. Maybe it's listening to some fun music. I have a friend who's a nurse that he listens to a comedy station on his radio on his way home from work. So asking yourself, what are the things that you can do that signify a transition, and finding that, using it. Some final thoughts here is that awareness, self-awareness is key to appreciating your own reactions to stress. Look for behavioral cues of your peers or even residents, family members that indicate that they're struggling. And view those people through a lens of curiosity and empathy. Find compassion in your own approach with others so that others will approach you with compassion. And be sure to utilize those key resources so that you can prevent compassion fatigue or intervene when you notice problems. I've included here some other resources for you. The Compassion Fatigue Awareness Project, there's a link here, a wonderful website that has tons and tons of information. There are some assessment tools that we're actually going to be including in this webinar, but you can find them there too. They're all free. I'd really encourage that you look at those. There's also some other readings that you can do. I want to thank you so much for this time together. And I want to direct you too to some other resources through the Consumer Voice and through the National Long-Term Care Ombudsman Resource Center. You can also connect with both of these organizations through social media, and I've included those there. And on behalf of the National Long-Term Care Ombudsman Resource Center and the National Consumer Voice, we thank you so much for participating in this webinar series. Take care and be well.